I've been to these conferences and forums for the last 25 years, and they keep evolving. And what I've observed in my work and my experience is that over time, different countries adopt different models, which is the best thing to do. So let's not copy what the UK has done, what Australia has done. Sorry, Moustafa. And let's not copy necessarily what Saudi has done if we are in the UAE or vice versa. Let's come up with our own models. They make sense. So today, unfortunately, two of my panelists who are from the government side did not show up. So all I have is very experienced 3 developers who have been in this business for many years. So it's probably telling that we're going to hear it from the private sector, because all PPPs have to work for the public sector, but equally important for the private sector and for the end user. So yesterday, there was a lot of discussion about can we include some core services in our PPPs, and why not, and what are the issues? Most PPPs in the social sector do include usually the UK PFI model or the Australian, Canadian PPP model, design, build, finance, maintain, some operations predominantly related to facility management, but very few include core services such as clinical services or core education services in relations to schools, for example. Now, more and more countries are looking at bringing the private sector to provide these services. So for the next 45 minutes, we're going to try to tackle this issue a little bit and hear from 3 experienced panelists on what are the advantages and disadvantages to add some of these core services in relations to some of these infrastructure PPPs. And therefore, this is the topic of today. Infrastructure PPPs or integrated PPPs. And integrated PPPs in the context of this panel is including core services as part of the deal, whether it's one deal, multiple deals. So I would like to welcome as well Ms. Munira to the stage. So I'm going to start with asking each one of the panelists a question and get their reactions. So let's start with Roberto. Please introduce yourself, introduce your firm, and tell us your experience about having an integrated PPP, and give us, if you have, a case study where it has worked or hasn't worked.
Okay. Good morning, everybody. I am Roberto. I'm representing Bâtiment International, that is the building division of the Bouygues construction group from France. The microphone doesn't work. Okay, can you hear me now? Okay, very good. Good morning, everybody. I'm Roberto Reale. I'm representing Bouygues Bâtiment International. That is a French origin group. It's the building division of the Bouygues construction group. My role within the company is to lead the business line dedicated to healthcare. So I'm somehow a healthcare specialist within the group. And to come to your question, Abram, is not that common in our experience, but the market is evolving actually to assume the risk, the traffic risk for hospitals. It's something that we are starting to see more and more, because more and more governments and the public sector actors are requesting also to have follow-ups on the operational side and on the medical operational side. So we are starting to structuring ourselves in a very different way from the past. That means including the capacity to bring with us in the operational partners that can, on one hand, take over of the full hospital operation, and we are on these days negotiating such a deal with a country in the region. Or we can also propose a solution where we bring experienced operators from Europe, North America, even Asia, to assist and manage the operation that still stay under the public sector. So we are talking about a public hospital that still have its own staff, but supervised by a third party that could be NHS trust, that can be a US institute, that can be a French institute, in order to provide the same level of quality that are experimented on those countries. In terms of which project I see that already happen on this way, it's a little bit complicated, to be frank, because concession, because what we are talking about basically is a concession, not a classic PPP. In healthcare are not that common. I see some cases now in Southeast Asia on a sort of hybridization between public and private sector. The only thing that I would like to say is that the success of this kind of project is linked to the clarity since the beginning of what are the legal frame and what are the responsibilities for each party in the transaction and what are the KPI of the project, because it's very difficult if these kind of elements are not defined at the beginning to then elaborate a project that is bankable for the investors.
Thank you, Roberto. Moustafa, same question. And if you can elaborate more with your experience in the education, specifically your work in Abu Dhabi, if they had added the education component to it, how would you have reacted?
Yeah, that's a good question. So my name is Moustafa Fahour. I'm the COO for Plenary. And Plenary's main target and focus has been around social infrastructure, health, transport, rail, metro, etc. Obviously, we've come to the Middle East over the last few years and won the first schools PPP project in Abu Dhabi, but we've also done a number of schools in Australia, so it'll be a good comparison. I think you hit the nail right at the beginning. There is no right answer, whether it's integrated or not. And there's local nuances that you need to be able to customize and create for the procurers. So if we're looking at the schools PPP in Abu Dhabi as an example, where the ADEC themselves are bringing their own operator, who's still from the private sector, and you're providing just the FM as a solution. While in Australia, they have local councils that come in, the school will form its own board and then put an operator that will work with your FM. One model isn't better than the other. It's up to us as a consortium on how we structure the deal, ensure the integration is working with both the client on the certain segments they're handling versus what we're handling. So to go back to your point, for me, I think what's important is that any PPP structure, the efficiencies and the success of it has more to do with the type of structure, the integrated framework, the interfaces are very critical to the success of the outcome.
Thank you, Moustafa. Karim, as one of the finalists on the schools in Oman, could you answer the same question? Had the government of Oman added core services to the education, what would have been your reaction?
Thank you. Can you hear me now? Thank you, Ibrahim. Good afternoon to you all. My name is Karim Eissa, Regional Director for Alghanim International, part of Fuad Alghanim group of companies from Kuwait. We, as Alghanim, we are currently working on, engaged in 3 transactions, one here in Dubai with the RTA, one in Saudi Arabia as a mixed-use development for Jubail, Dareen mixed use. And finally, our latest flagship transaction is Al Ansar Hospital in Saudi Arabia. Al Ansar Hospital is the first of its kind, a public-private partnership with the Ministry of Health. It's a 244-bed emergency hospital built over 15,000 square meters with a built-up area of 90,000 square meters, which will vastly improve the capacity of healthcare for Holy Medina city, for which we are truly honored. In terms of future transactions we are working on, our biggest transaction at the moment, as Ibrahim said, is Oman Schools. And for that, we believe that really separating the core services from the conventional PPP, let's say, allows the developer to focus on their main deliverables, and at the same time keeps the risk for the service provision for the entity that is more capable to deliver it. Having said that, there are also many benefits in having a holistic approach to such a project. But we are more than comfortable with the arrangement that Oman Schools had as a procurer, because it keeps the risk allocation in the right side of the equation. So for that transaction, we believe this is the right way forward. Thank you.
Thank you, Karim. Ms. Munira, you work in the government. I know governments in the UAE, in Saudi, in Oman have dabbled into private sector delivering services such as dialysis, mental health, but without having to build the infrastructure with it. So maybe you want to take it from a government perspective and tell us what's your experience and expectations in terms of an integrated PPP in the health or education sector.
Hello, my name is Engineer Ameera Manaseer. I'm from the Ministry of Energy and Infrastructure Development. I work as a PPP specialist in the ministry. And thank you for your question. Regarding the investment in the PPP in social projects in the infrastructure of the government, as part of the Ministry of Energy, PPP policy and guidelines development process, Ministry of Energy screened and ranked 20 federal projects. One of the highest ranked projects suggested for the first year on the PPP strategic implementation plan is Juwayzeh Hospital. To develop a high-level financial and commercial visibility of the project in order to assess the PPP implementation potential of the project. The project scope covers development and operation of a hospital in Sharjah, Emirate, with capacity of 500 beds. All clinical and clinical supporting activities will remain as the responsibility of the Ministry of Health and Prevention.
Thank you. Well, I'm going to now peel the onion a little bit more. Let's talk about what the gentleman, the lady mentioned about an integrated. While the risk allocation plays a big role in PPPs, but as an observer of this market for the last 25 years, I'm seeing a trend, more and more governments, specifically in the GCC, expecting the private sector to take some more risk. Operational risk, not only from a design, build, facility management, but as well as some core outcomes, whether clinical or education services. So my question is to especially my private sector panelists, is if this was added, and some of you has touched on it, but if it is bolted into the PPP, what will be the ideal solution and deal structure? Not necessarily as, let's carve it out and have another O&M contract. So how would you react if, for example, I'll give you a real example, a hospital project that says we need 250 beds, brand new hospital, secondary or tertiary care, and come and provide the clinical services, and we will guarantee certain bed occupancy. There'll be an off-take. But I want to contaminate the cash flows. Instead of not contaminating the cash flows for the building, I want to give you one payment, and then you provide the service. Mr. Roberto.
It's already better of what I experimenting, what you are proposing. So thank you, I will take it. Anyway, There is no issue once the medical program is clear. So what it means? Basically, the request is to have a sort of private operational hospital that take care of the full public spectrum of services. So it means that you have to, even being a private, you have to provide public and guarantee public service. This could mean that some of the medical services provided are not profitable. In that case, the solution, even if an availability payment is granted, the solution will be, okay, let's consider it, let's do a market study, let's do a business model, and let's identify what are the source of the revenues for the project. If we discover that the occupancies with the non-profitable services is the majority of the occupancies rate, it means that we will need a support from the government, call it as you prefer, as a revenue guarantee, a top-up guarantee, something, in order to match the breaking point for payback, capex, and opex. This is a little bit the solution. If it's not possible because there are constraints about sovereign guarantees to the existing public debt, in that case, the solution is, okay, let's open the door also to private insurance systems. So let's have also an hybridation between public and private for the assets in order to guarantee higher revenues from the private sector in order to equilibrate the public service provided with the private service provided.
So let's continue with the same. So assume there is a national health insurance, and the hospital is basically for people who have access to that local health, mainly the locals. How would you react if, and the health insurance will stipulate whether it's a DRG or some other payment, what will be the payment? So will that make the deal structure more appealing to you?
Yes, definitely, until the insurance payment system and is calibrated with the real private cost. Because sometimes there is this non-alignment between the expectation of what a service costs today with the public service and what is the real cost for the private. Because sometimes the public, when they receive, I don't know, for example, audit from the Ministry of Finance, they don't pay for that service specifically. But if a private have to do this kind of audit, of course, we have to pay for this kind of services. It means that is an additional cost to be added to the clinical cost that is sometimes not perceived as a cost by the public. So everything is, I think that, again, I come back to what I was saying before, everything starts from a clear term sheet at the beginning of the process. Once there is clear what are the steps, what are the KPI, and what are also the payment condition, then everything can become viable.
Thank you. Moustafa, I realize in some parts of the world, health delivery was based on some kind of a capitation type of a deal structure. I don't know if Australia toyed with that idea, I believe, at one time or not. What's your view on the deal structure as the same question as to Roberto?
Yeah, I think Roberto answered it, in more detail from the structure, but we sort of look at it from the outside perspective because it's critical to procure when they procure a deal that they put together, that whatever risk you want to pass on to the private sector, it's been tested, trialed, is there data, isn't there? Some procurers are building things for the next 10 years, so you can't guarantee the numbers. Or some are creating a brand new toll road where it's never done. So, I think the structure, as Roberto was saying, right from the beginning is the most critical outcome. Because we as a consortium lead, what we will look for is bringing the experts within to provide that service. And if those subcontractor or contractor experts aren't willing to take the risk, it means there's something fundamentally wrong with the structure of the deal. So I don't think it matters which country. Some countries are more mature. They have data, they have the numbers, they have the flow. Some countries don't. It's a new concept. So I think the deal structure is the most critical to answer that outcome.
Karim, if you can answer it and tell us a little bit more about what will be a sweet spot in terms of the deal, the term, tenor type of thing. So in the context of integrating services and bolting it into an infrastructure PPP?
So under Fuad Al Ghanim Group, we operate a different range of services in terms of healthcare, from owning and developing our own hospitals, private hospital, all the way up to PPP healthcare, similar to Ansar project, for example. At the end of the day, everything is possible. There is no right answer. The question is all about the allocation of risk, about the term sheet and the agreement itself, to make sure that there is clarity on the definition of responsibilities, who is doing what, where the risk lies, what are the KPIs. This is the whole point. Now you can go for a fully integrated, full recourse, a very let's call it a developer real estate kind of a hospital. In that case, the deal will take much longer in terms of assessing the business case, assessing the demand, what services need to be involved, and all of that. So it all depends on the time scale that is required, the tenure of the project itself.
So what's the sweet spot for a tenure?
If we're talking about a healthcare project, I think we're talking at least 20 years. At least 20 years.
Moustafa, would you agree 20 years is?
Yeah, it all depends on what the industry and what the project is. They're critical, and how the structure. But on average, anywhere between 20 and 25. You want it sort of not too long, because, private sector's taking risks and etc., but not too short where you can't capitalize on, making a return as well for the risk you've taken.
Yeah, Ms. Ameera, you mentioned that there were a hospital in Sharjah. Are you looking for other things in your pipeline for projects in the social accommodation sector?
Yes, we have around 20 projects around UAE, which are ranked as the best projects to be equipped through the PPP. But Juwayzeh Hospital is one of the 5 projects that the ministry is interested to develop during these 2 years.
Any other projects in the pipeline that the audience might be interested in that you can share with us?
All our projects is regarding governmental projects. There is another hospitals in Sharjah also, and also in Ras Al Khaimah.
And how large are these hospitals, do you know?
Most of them are in the capacity of 500 beds and above.
Okay, thank you. All right, I want to turn it a little bit differently now, and talk about what's the best way for government to monetize some of their opportunities in the social sector. Now, some of you have dealt with me on different projects, whereby a lot of countries in the GCC are saying, we have land, we have a need, but maybe have too much excess land. And that has been socialized in the deal structure in Oman for the schools, for example. So what's your view, gentlemen, about adding certain commercial activities to these deals and to offset partly or fully some of the costs to the government? So real estate, mixed use, commercial activities, in relations to the site. Obviously, you cannot build something that doesn't go with the use of the site. Roberto.
But it's something definitely that can be added. It can represent also an extra source of revenues. So it's definitely something to look at. On hospitals, we especially if we look at the UK models, it's something that is pretty common to have the parking areas, to have the retails somehow areas like a flower shop in order to generate additional revenues. So definitely it's something to take in consideration. But again, I repeat.
But these are very small stuff. I'm talking about if there is a plot of land, 100,000 square meter, 30, 40,000 is needed for the building. And there's another 50,000 that's available.
In that case, you are asking us to become also developer of other aspects. So everything needs to be studied. But in case of Bouygues, we are not looking exactly at that kind of structuring. If we are, if it's something that we could consider of interest, then we will look for partnership in order to bring in developers specialized in that kind of developments. For example, hospitals normally needs also to have accommodation next to them for families, so long stay residences. And so most likely hospitality development associated with an hospital. But in that case, again, we will look for strategic partnership in order to bring a developer that can develop and specialize in hospitality to develop and manage the hospitality part of the healthcare facility.
I might help you, Abraham, because anyone that knows Abraham is very forward-thinking and likes to touch the sensitive spots, especially for the private sector. In Australia, we do this, and it's very common. We also have a property division within Plenary. Looking at the GCC or UAE for international developers, where they're starting to grow the social infrastructure, because it's relatively new outside of the energy, water sector. So what's happened is the growth of those projects and the number of those projects, the simpler they are, the quicker they can get up. Because over here, everything needs to be fast. So I hope that sort of answers your question.
Partly. Karim, without providing any confidential information, in Oman, we asked the bidders to do partially some commercial development. So what was your thinking internally when that was question that was part of the tender process? That will be helpful for the audience probably to gauge how a private sector think by combining and contaminating an infrastructure project with commercial activities.
For Oman schools, we face two issues on this particular point. The first one, wearing a real estate developer hat is different than a PPP developer. So in terms of getting the finance from the financiers, the deal structure, the non-recourse, the demand availability, and so on. So these are two different things, and mixing them creates a little bit of confusion in terms of getting the finance and the risk appetite for the project. So this was one issue. The second point is real estate development requires certain criteria. So you need to have a proper branding, you need to have a track record in terms of being a property developer or a real estate developer, which may not be part of a PPP hat developer service provision, let's say. And therefore, it was a bit challenging, both for us as a PPP developer, but also for our financiers to provide the finance for these projects. So I hope
But I would like to get into your thinking when you, strategy-wise, from a risk allocation, how did you look at it?
So eventually, in the Oman schools, the real estate element was taken out. Finally, was watered down, let's say. We made certain assumptions for the use of the facilities themselves in terms of using the schools outside of hours and all of that. However, this does not come into the model because it's an opportunity. It's not really part of your...
It's an upside.
It's an upside.
An upside for both.
It's an upside, exactly.
Okay.
Abraham, also, what's important, and my colleagues here will grill me if I don't mention it, is the financing component and the bank's appetite. 80% of your deal, roughly, has to have banks to get comfortable around it. So
it becomes maybe 10 to 30% for the capex and 60% plus for purely operations and maintenance and life cycle costing. How do you analyze that opportunity or lack of opportunity?
But for me, it's not a lack of opportunity. For me, it's the opportunity because, but this again, come back from the planning area, from the planning at the beginning. So when you have your planning well done, you can also understand that. It's working?
We cannot hear you.
It's on.
It's on.
That's all.
Hello? It works?
Yeah, we can hear you.
Okay.
Okay. So actually, is more. I look at it as an opportunity, as I was saying, because but it came from the planning moment. Because through the design and the cooperation, before it was said that it's like a marriage, this kind of partnership, no? Through the cooperation between all the stakeholders of the project, you can identify the areas where you can interview. And also, if you have the OPEX, you can reduce the operational cost during the planning. Of course, this generates more opportunity later on. I don't know if I'm expressing...
No, but let's get in deeper. how do lenders look at contaminating operating cash flows with infrastructure cash flows? So you're going to get 100 unit of payment, where traditionally 70% of it goes to the infrastructure, now 30% of it. And there's a risk that the operational cash flows might affect the infrastructure cash flow. Do you get my drift?
But here I'm not getting exactly what you are saying, because I think you are mixing up. So we are talking about a classic PPP structuring where we have hard facility management in place. That is the case that you are describing. So 80% for CapEx repayment and 20% for OpEx linked to HFM. Or we are talking about a concession where the traffic risk is allocated completely to the private. And in that case, you have, of course, a flip, because the operational cost will be higher than the CapEx cost.
That's the, yeah.
Okay, but in that case, again, clarity is the key. Once you have clarity on what are your potential traffic flow, and you have clear ideas of where you will stand in 10 years' time from now on an operational standpoint of view, then the financial sector will be more or less adverse to risk, depending on who is.
The clarity could come from the government saying will guarantee to occupy 60%, 70%.
No, the clarity came when, because the occupancies, if they are telling you we are occupying 70% of the beds, but as I was saying before, with clinical services that are not profitable, you understand there is a risk, and the risk is clearly perceived by the market and the financial institution. The issue is if through these 70% occupancies, I guarantee you to also cover 70 or more % of the cost linked to the OpEx, then the risk allocation and the risk perception is different.
But
So I think
in this case, you haven't transferred the operational risk. If I'm guarantee you to cover 70%
But
of
no,
OpEx.
okay, but in that case, you have to guarantee to the private sector. Okay, so if you want to have such a model, you guarantee me the opportunity to choose the services that I'm providing, and you not impose me the services, because if you're imposing me services in order to keep a public services, then it means that if those services are not profitable, I will operate on lost, and this is not possible.
Suboptimal.
the funny thing is, Abraham's asking you the question, but he knows the answer, because if anyone's procured with commercial risk has been
Yeah, of
him.
course, of
So
course.
Abraham, why don't you tell us?
No.
What you are expecting from us? This is the
That's
question.
cute. That's cute. That's cute. Do you have a view on this?
Look, the only parts, if you want to generalize it as commercial risk that you're taking, or tolling risk, etc., you know, the way it's procured, the way you handle it, and I think you've had experience out of all regions on this, between the schools and now the truck road. There's got to be an element of where the government needs to step in. You know, there's only a certain element of risk you can take depending on the structure, and there's only a certain element the banks will risk there with it. So that structure's very important. Is it something we won't look at? No, we will always look at it. And the question is then, is how innovative will you get in structuring it in a way to make it bankable?
Karim?
I think we have to recognize that this partnership industry is still evolving in this part of the world, which means that we have to take it step by step in terms of allocating the risk to the private sector and to the financiers. Now, maybe in 10 years, 15 years' time, there will be more appetite to take on some of this operational risk on the private sector side. But as of now, I think the appetite will be very limited until the model has been tried and tested for a few years.
Thank you. So, full disclosure, Moustafa knows I have the answer. And I've been toying with that answer for the last 3 years. I think there is a model where we can find a mechanism to calibrate the opportunities for the private sector and the government. Not necessarily what Roberto said, I'm going to pick and choose which services I'm going to provide. No, on the contrary, the government has to provide the basket of services, has to guarantee certain occupancy, i.e. 60, 70% of the beds, and whether there is an insurance scheme in place, or the government will ask the bidder to say, how much would you charge for these services, which I designed, I put in my specification, and I gave you the occupancy, irrespective of what the market is. So you are bidding for the services with a guarantee of occupancy. And that's the model I've been advocating in education, in health, and as Moustafa knows, in the transport sector, where you are bidding for the service, which includes the infrastructure with it. Whether you bid it on transactional basis or you bid it on a wholesome basis, that's a detail. So in a way, we're translating it into an availability-based payment, but with certain offtake guarantees.
Yeah.
Right?
Going to that point, Abraham, what's really important, and maybe I say this for the government procurers of projects, etc., that do this, I think this is where market sounding, as you know, is very important. Because then you can see the appetite of the banks, the appetite of the private sector, etc., on how these innovative structures in the region can be bankable and can be structured.
Karim, do you have major disagreement with what I said?
Not really, no. I tend to agree with what you're saying. It's all about the clarity in terms of the framework of who will do what and how the risk will be allocated.
Ms. Ameera, do you have views on?
Yes, in selection of appropriate PPP model structure in the health sector depends on various factors, should be tailored as a specific context such as needs assessment, also define objectives and outcomes, financial viability assessment by evaluating the financial viability of the PPP model by conducting visibility studies and financial analysis. Also, risk assessment and allocation is very important.
Thank you, Ms. Ameera. Anyways, I'm going to close on this. If you have any final thoughts that you'd like to leave, but it's critical that the private sector accompanies the public sector in their journey. And yes, the first 2 or 3 deals might take a longer. And I think PPPs are, as my previous panelist said, marriage, long-term marriage. And it is, but at the same time, it has to be a win-win-win. Win for the private sector, win for the government, i.e. value for money, and win for the end user, that they're getting access to better services, or they're elevating their experiences with these services, whether it's education or health or transport. Final thoughts, Roberto?
I just repeat the word. Clarity since the beginning is the key. Also, the framework,
planning.
Exactly. Once the frame is clear, everything is clear and can be done.
Yeah, I think planning is the most important element. So if governments pre-going to market have really prepared, done their market sounding and got the structure right, then the rest of the process will tend to come together.
And I heard you say market sounding.
Yes, please get our views, everyone's views.
Good idea. Karim?
So I agree with my colleagues. I mean, it's careful planning, robust contracts, and continuous monitoring to make sure that the deal is progressing in the right manner.
Ms. Ameera?
I agree totally with my colleagues, and creating an enabling environment for PPP, various factors like clear laws and regulations are essential to facilitate and govern healthcare PPPs. Also, strong political commitment and stability are crucial for the success of the healthcare PPPs. Robust governance and oversight mechanisms are necessary to ensure accountability and the proper management of the healthcare.
Thank you very much. Thanks for the audience for listening to us, and I'd like to thank all my panelists for their contribution.